Hey, you want to see what a urine lab looks like? Come, look how gross. This is what we do day in and day out. There's a systemic flaw in the healthcare system today. We go to the doctor when we're feeling sick. But if we go to the doctor when we're feeling sick, it's already too late. It's estimated that if we were able to early detect the 3 most popular chronic diseases today, we could reduce trillions of dollars in healthcare spending. The problem is, how do we know what's happening inside of us? Short of going to the doctor on a regular basis, which is completely impractical, how can we tell what's growing inside of us? Is it possible? Well, it wasn't until now. All of Diagnostics have made it possible. Hi, my name is Goldman, and along with the head of the urine labs in the Hadassah hospitals in Jerusalem, and a dedicated team of optical engineers, data scientists, and neuroscientists, we have developed a sensor that you mount onto the toilet, and it does urinalysis every time you urinate. It's checking your health every time you pee. We are backed by Maccabi, an Israeli HMO, Cleveland Clinic, and Amgen. Urine has thousands of biomarkers, and if you add to it volume, color, and frequency, you are able to early detect thousands of diseases, such as hydration, UTI, kidney stones, and heart failure, not to mention cancer, diabetes, and prediabetes. The underlying technology is spectroscopy, a technology that was developed in the 60s. With advancements in speed of sampling and the reduction in component costs, we have been able to reduce our bill of materials to $50 per sensor. The real money is in the data. And this we are selling to people using a SaaS model. What inspired me to start this company was when my mother was undergoing chemotherapy in Jerusalem, and I was located in London managing a large company. The desire to get information about her vital conditions. Is she drinking? Does she have infections? Are her kidneys deteriorating? Was so important to me that I left my position there and started Olive Diagnostics. People who are my age have parents who are their age. Wouldn't it be good to be able to continuously monitor the people? Our patent pending and trade secret technology is undergoing clinical studies at Hadassah in Jerusalem. Today, our device can detect protein, nitrites, red blood cells, volume, color, and frequency. And we do it at a whopping 95% accuracy, which is way above any other home-based urinalysis system, namely urine sticks. Urine sticks today still require you to capture the urine in a cup, dip it in, and then take a picture. With our technology, all you have to do is pee, the same way you have your whole life. Throughout 2021, we're going to be adding more and more molecules to our system. Today, we are raising money to move our product from an MVP to our beta testing. Our beta testers are going to include Maccabi, Tzabar, who's an outpatient service provider, and 2 assisted living facilities in Holland. In addition, it's going to finance our CE self-certification, our FDA pre-submission, and our entry into the Dutch market. The last year and a half has taught us a lot. The main message has been social distancing and stay at home if you can. Because of this, there's been a surge in the market in telemedicine companies and home-based diagnostics. Olive Diagnostics is very well positioned to provide something that's been talked about for years, to analyze excreta. Excreta tells a really, really clear story on what's happening in your body. I would like to take an opportunity to thank both IBM and Hadassah for assisting in both the clinical and the technological part of our company. Thank you.
Well, thank you for this kind words at the end of your pitch, and the pitch itself very comprehensive. Thanks a lot, and I welcome Guy here with me at the studio. Guy, welcome, and
thank you very much.
I know it's been a journey for you from Jerusalem. Normally we do it vice versa, so no complaints for you.
Yeah, exactly.
We do have one question about your go-to-market strategy. Can you elaborate on that?
Sure. So initially we're starting with the third age monitoring, remote monitoring of the third age population. We're actually looking at those companies that will gain the most by preventing people from going to the hospital. By being able to do early detection, we can tell what's happening inside our body and know that certain viruses or infections are growing inside the body. And by doing early detection, obviously we can do early cure, which is substantially improves the quality of life of people. So we're focusing on three major markets, on the assisted living communities, the telemedicine, and the outpatient services. Those particular companies actually gain money and quality by having the people not go to the hospital. So if you can early detect, for example, a UTI, then you can take care of it with antibiotics. If you don't early detect it and the person becomes symptomatic, then they often go to the hospital, and they could be in the hospital for like 2 weeks, which is an extended period. So those are our three markets. The benefit goes to the company or to the organization that will be actually purchasing the product for their patients. After that, we're going to roll out to the more general public in more of like a wellness type application.
I see. So as a go-to-market strategy, do you have a plan, and what to what extent your plan covers this go-to-market in terms of the duration? In when you're going to have a selling product or buying customers?
Yep.
And what's your vision here for the long term?
Good. That's a great question. So initially we're starting in the European market. The reason we're doing that is because we can do a CE self-certification, which is a much easier process to go through versus the FDA. So we're starting very, very focused, one country in Europe, selling to those three industries that we spoke about. And then at the same time, we're doing our pre-submission to the FDA to start our FDA process. So we're required to do something called a de novo, which is a kind of an extended, take us between 9 to 12 months to do, but we can already start making revenue and showing that we can sell product. We're looking at reaching the European market already at the end of this year, at the way end of this year to reach the European market, and then be selling throughout Europe throughout 2022, and then hopefully at the beginning of 2023 already get to the US market with the FDA approval.
Well, I guess if no further questions, this is a time to thank you for your questions and for the entire journey you had with us. And for that, I would like to hand you also our graduate certificate and trophy. This is for you.
Thank you very much.
And Guy, good luck.
We will be seeing each other a lot,
yeah,
I'm sure.
And the toilets is just around the corner.
I've heard it all. Thank you very much for everything for this past 6 months.